So these innovations I was talking about with the tightrope fixation, the ability to retension is the game changer for me. So the idea that when you have a quad placed, or you place your hamstring, or you place a patella tendon, and you're pulling these up, and again, the Arthrex tightrope for me is sort of all versatile. Now again, it's a different tightrope for the patella tendon, but it's something you should know how to do. If you ever blow out a back wall of your ACL, and again, maybe you're so good you've never had that, but it can happen. And if you do that, the tightrope obviously is a backup that you use. In my practice now, I do it all the time exclusively, so it's not something you have to stress about as much. Obviously, we still want to make sure the tunnels are excellent, but it's just something to be aware of. But when you do this, the idea is that initially you can only pull so hard and you can only tension the patella tendon so much. And so the ability to have this back tension, so what happens is after you tension it, you can actually get it a bit tighter. And then adding the internal brace, which we've seen in biomechanical studies, especially that first 0 to 6 months when the graft is at a higher risk, it can really help stabilize things, and it gives me sort of a safety belt. I think the best example I have is people say, well, you're driving in a car, so why wouldn't you put your seatbelt on? The idea of the seatbelt, especially for that first 6 months, is incredibly important. So this is some of the newer techniques we're doing. And even in allografts, which again are cadaver grafts, which we do in patients, usually 35 and above, maybe a significant 3 or 4 revision situation, we have seen improved tightness. I have seen it's easier in the operating room, especially with these combination and HTO or other complex cases, to have the ability to retension these grafts, because these allografts, when you set them, can sometimes feel a bit looser than using your own tissue, but obviously a lot less morbidity. And so when we retension them, and I like to use patella tendon for my allografts, the tightrope, the switch has been completely amazing for me, and I've been really, really happy with the ability to retension, and I've been feeling, a difference in my patients, and I've been feeling much more confident in the ability to do this. So I hope this helps you with some of the tips and tricks. Obviously, there's lots of other things we can talk about with the ACL. It's an exhaustive conversation, but I want to make sure people understood sort of what we're doing new and innovative at Orthopedic Specialists of Seattle, and sort of what I think is kind of the next step. And again, there are more things like, can we find ways to remove any metal in the patient's body? Can we find innovative techniques to fixate everything with all suture? And we're gonna be there, but we're not there yet. And can we add more biologics to make these ACLs heal faster, or can we repair them? And that's a whole other topic of discussion.